Hello and welcome to 18 WJTS Inform. Today we're going to find out another service provided by TRICAP. TRICAP's known for all kinds of different things, weatherization, Head Start, I could go on and on and on, but something else that they do is they offer help for those who have breast cancer. And joining us in the studio is Deb Capps. Deb is the Director of Health Services at TRICAP. Also joining us is Jan Slifer. Jan is the TRICAP Breast Cancer Case Manager, worker. Okay. Welcome, ladies, to both the show.
Thank you for having us.
The breast cancer is a terrible thing. And with healthcare costs anymore, it can be even more devastating for a family. But that's where TRICAP comes in and helps. Deb, if you could explain what Jan does, and then we'll let Jan tell us what she does.
I will do my best. First of all, Jan is located in our Evansville office, but she covers a wide territory that she'll share that information with your viewers with. But basically, when someone is diagnosed with breast cancer, if they notify their treatment provider that they can't afford treatment, then that treatment provider should be referring that client to us, to Jan specifically. And then Jan will talk to them about the income guidelines and make sure that they are in our radius and meet those guidelines, and then she'll work with them to actually help pay their invoices.
So if somebody feels they can't afford it, it may be that they don't have any insurance, or they might be underinsured.
Underinsured.
Which could just simply be that their deductible is so high
Correct.
that they can't afford to pay it, because deductibles anymore are very high and really can hurt a family.
That's correct.
So explain that part.
Okay, well, we consider underinsured folks that have anywhere from a $3,000 to $5,000 or more deductible. For those folks, getting treatment is difficult. So in order for us to assist them, if they meet an income requirement, a lower income requirement, then we help with their breast cancer expenses, paid directly to the vendor or to the provider. And we have a cap, of course, based on the amount of money that we have to share. But that's how our program usually works, that we get a referral from a medical provider, and we get in touch with those folks, and then we go through the application process.
Do they have to go to specific medical providers, or does that not matter?
No, it doesn't matter.
Okay, excellent. So they can go to any.
As long as the people that are participating in our program are in our coverage area, they can have any provider.
Now,
I'd like to share that these are funds that are being provided by the Susan G. Komen affiliate of Greater Evansville. So we get a grant every year from them, so that help us to be able to make these payments.
So what is the area then? You cover all of the TRICAP counties, which the TRICAP counties are, if I can do this, Du Bois, Pike, and Warwick.
Correct. But several of TRICAP's programs go beyond those three counties. And I believe that our breast cancer program covers the most counties, although weatherization might be even further. I'm not sure.
In Indiana, we do Davies and Du Bois, Perry, Pike, Posey, Gibson, Knox, Spencer, Vanderburgh, and Warwick.
Wow.
So that's a lot of counties in
Yes.
Indiana. And then we have 10 counties in southeastern Illinois and 8 counties in western Kentucky.
So you cover a really wide range of
Wide range
helping
of
people
people.
out. So the Susan B. Komen,
Susan G. Komen.
Susan G. Komen breast cancer walk fundraiser that they do
Correct.
benefits folks in a local way.
Right,
Oh, yes.
yeah, so those monies that you might donate to the Susan G. Komen in Evansville, whether it's at their More Than Pink Walk or any of their other fundraisers, they put all those monies together, and then agencies like TRICAP can apply for those funding. And TRICAP has had this grant for, over 15 years. So this is one of our longer lasting programs that TRICAP has had.
Last year in our grant year, we assisted 53 people.
Wow.
So far this year, we've done 27. So we're reaching out and we're helping a lot of folks.
Who needs to come and see you? Is it the person that is diagnosed with the cancer? Is that generally who you see, or is it the medical provider?
No, it's the person that's diagnosed. We say recently diagnosed, meaning within the last 6 months you've been diagnosed with breast cancer, men or women. I want to stress that we have had a couple fellas. And they're the ones that reach out to us. The medical provider refers them. I get in touch with them. We fill out an application, do the income verification, and go from there.
What sort of assistance do you give?
Well, we help with the medical treatment through the Susan G. Komen Foundation. We help to pay surgical expenses, anesthetist, chemo, radiation, any medical expense in connection with the breast cancer diagnosis. We have another program as well. It's called through the Indiana Breast Cancer Awareness Trust. And that program, we offer assistance for housing, either rent or mortgage or utilities. Sometimes folks have Medicaid and they don't require assistance from the Susan G. Komen Foundation, but they require assistance in keeping their rent. Breast cancer causes many people to lose their job or to work less hours, and it's harder to pay their rent or mortgage, utilities, and so through the Indiana Breast Cancer Awareness Trust, we help those people.
And they're on a lower income anyway, so,
Oh, yeah.
so this is really, instead of it being a setback, you're helping them to.
I'll hold this up.
Yeah.
It's the Indiana has this breast cancer plate, and that's what funds the Indiana Breast Cancer Awareness Trust.
Okay.
So for every plate that's sold, we get $25 into that trust, and that's how that money is funded to us.
And you do the big things, which is help pay the bill, or help them with mortgage if they need that. But you also do a nice little kind thing, and you have a care bag.
Yes, we do. We call this our comfort bag.
Okay.
And every comfort bag has a blanket. It has a journal that we have found that most people like to write down their experiences, or kind of makes them feel better sometimes if they can put their thoughts on paper. It can have a lot of different things in it depending on what we're generously given. We have a water bottle, lotion, so
Just things that make
things that make a comfort bag.
There you go. Make you feel more comfortable, right? Because it's a tough time when you find out you have breast cancer.
Yes, it is.
And then it's even tougher when all of a sudden these bills start coming in. And I'd imagine some people wouldn't get the care they need if this did not exist.
Probably not.
That's true.
Yeah, and that's the sad part.
But it's at 250% of the poverty level. So roughly, a single person living alone who's diagnosed with breast cancer and is making $31,000 or less will qualify for this program. So it's not just low income. 250% of poverty, that's putting you up. You know, most people wouldn't consider, well, I make $30,000 a year. You know, I live alone, I make $30,000 a year, I'm not poor. But you are considered in that poverty level, and you would qualify for this program, and that's an important thing for people to realize. So none of us want to take a handout, but when you're going through something so significant like this, you really do need the help and encouragement. And she does so much more than just help them with their paying their treatment bills and stuff. She's really that person that they can call and say, I am having a really bad day. Because they don't often want to talk to their family or friends because their family and friends are hurting as well. But they can call her and talk to her and just vent it out, get it all out of there. She may not be able to do a single thing, but they know that she cares and that she heard them. And I think that that's one of the most, you can't put a price tag on what she does for these clients.
So if somebody is in this situation and they want the help, that's the most important thing, is they need to decide, well, let me find out, I need that help. What's the step they should take? What do they need if they come to see you?
Well, if they want to call directly and contact us at TRICAP, we're located at 727 John Street in Evansville.
Okay.
They can call our office, 812-428-2189, and talk with me. I'll be happy to make an appointment with them, and I'll tell them, you know, the things that they need to bring. But normally it's the proof of their income, and then we need verification, of course, that they've been diagnosed with breast cancer.
And then I assume they bring you a bill?
Oh, yeah.
Okay, so if they qualify and that part's all done, and then they get a bill, and it's a $5,000 deductible, and this bill is for $4,500.
That we'll talk to them and tell them, you know, based on the amount of money that we have available, the portion of that bill that we could pay. We often contact providers and ask them if they will reduce the bill because we are going to assist the client. We offer the client referrals to other places that may be able to help them too. Most hospitals have foundations that can help with some of those expenses, and so we encourage our clients to apply there. We refer them to other agencies that may be able to assist as well.
So you're in a way also a resource
Yes,
for
we
them
are.
to get help. But this is for folks who have been diagnosed,
Correct.
right? Okay. But you also do some things with, you have the mammography mobile unit come through and do mammographies, things like that. So
Right.
TRICAP does so much, it's hard to even pinpoint any one thing you do.
Right. So we have partnered with Deaconess Mobile Mammography to come out to our office sites and to offer free or reduced mammograms to women who fit within the criteria for it. And so that happens a couple of times a year, but we internally, we have that information. They don't have to come to TRICAP to get that mammogram. We can tell them, well, you can go get your mammogram at Memorial Hospital, and this is the number to call. Or if you want to go through Deaconess, this is the number to call. Or you want to go through St. Vincent, this is the number to call. So we'll let them choose where do they want to go. But we do have Deaconess Mobile Mammography actually on our parking lot twice a year.
We also do outreach.
A lot of
in
outreach.
the community. We do health fairs, public speaking, that kind of thing, that we try to get the information out about breast exams, how important that is, and try to educate people about breast cancer.
Now, you've got a shower
I do.
card with you.
I brought a shower card that you can hang in the shower. It gives you the points. It also helps you to just learn how to do the self-breast exam. So we pass these out at our various events.
So basically, I guess if you have any questions or concerns about breast cancer, first thing to do may be to call TRICAP.
Yeah.
And then you can get people going in the right direction.
Right.
Correct.
Anything else you ladies would like to add?
No, only that we do accept donations.
Okay,
Oh, we do.
sure.
Yes.
Sure, yeah.
And, you know, one thing that I have found is as we age, we don't need more stuff for our birthdays and our anniversaries and happy retirements. And so that's a nice way to honor someone for their birthday, is to give a donation to TRICAP for any of their programs, but for their breast cancer program.
Okay, so that takes money to be able to help the folks.
Absolutely.
I'll just share the biggest donation we ever got. Somebody came in and brought us in 5 gold coins. 5 gold coins, what could that be worth? It was worth, I think, over $6,000,
Wow.
what those gold coins were worth. But they knew somebody who had suffered with this, and they wanted to make that donation. So we will take your coins, pennies, whatever.
Take whatever you can. All right.
Absolutely.
Well, thanks both of you for coming in and talking with us.
Thank you.
And remember that these breast cancer services are available by contacting TRICAP. Our guests have been Deb Capps. She is the Director of Health Services at TRICAP. Also joining us has been Jan Slifer. She is the TRICAP Breast Cancer Manager, Director?
Case manager.
Case manager. All right. Thank you very much. Thank you for watching 18 WJTS. We're local people watching local people.